Begin by listing the organs of the respiratory system. The nose, the pharynx, the larynx or voice box, the trachea, also known as your windpipe, the bronchi. The primary bronchi will enter the lungs, and finally, the alveoli, which are the air sacs in the lungs. There are three functions for the respiratory system. The first function is gas exchange. This involves the exchange of oxygen and carbon dioxide between the alveoli and the pulmonary capillaries. This occurs across a respiratory membrane by diffusion. The second function is to clean, warm, and moisten the incoming air. Ciliated pseudostratified columnar epithelium and goblet cells, which produce mucus, are going to be involved in cleaning and moistening the incoming air. The mucus helps trap any particles in the air that you breathe, as well as moisten the air. The cilia helps move that mucus toward your throat so that you can swallow it. It will then move into the stomach and be digested. The venous nasal sinus is a collection of blood vessels under the epithelium. The blood in these vessels helps warm the incoming air. Recall, blood carries heat. Have you ever noticed that if you're pale complected, your nose looks red when you are cold? The reason for this is vasodilation occurs of the nasal sinuses. This increases the blood flow into the nasal sinuses to warm the air. The third function is the regulation of blood pH. This is done through the elimination of carbon dioxide when you breathe out. The respiratory system is organized into an upper respiratory system and a lower respiratory system. The upper respiratory system begins at the external nose, includes the nasal cavity, paranasal sinuses, and ends at the pharynx. The lower respiratory system includes everything inferior or below the pharynx, beginning with the larynx, moving to the trachea, the bronchi, and the lungs. So this will be the boundary here. Upper respiratory will be all of this. Lower respiratory will include all of this. In addition, the respiratory tract can be divided up into two zones. A conducting zone, and this is part of the respiratory tract or the tubes that are involved simply in moving the air in and out. And the respiratory zone. This is the zone where gas exchange actually occurs.